Actually,
we are in big trouble achieving that target.
no problem, bhai. If you are determined,
I just want you
yeah, yeah,
to
yeah.
highlight some points
Some parts.
that
Okay, okay.
how we think, how
Okay, 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 okay. I think I believe one day you will achieve such pie chart.
by your
Yeah,
maybe
because it's not the scenario of a day. From 2009 and after 2024 we achieved that. It's a gradual work. We previously we worked publicity, the miking, the community mobilizations, the community work. You also is doing now uh, hundreds of trainings to the local uh, healthcare providers, authority surgeons, gynecologists, pediatric and pediatric practitioner, and community health workers. And after that, we made a network. And the advocacy we got from the parents of the previously created babies. They are the counselor of their own community. After that, we have got such number of patients. Thank you.
One thing I share to you. You know already 11 physiotherapists working in Bangladesh. Look our stance. Look our mind setup. There is not an organization we are belongs to. For this reason, everything we are overcoming, all are not of the personal way. So, keep your prayer to us, then our bonding, our strength is forever. Thank you. Thank you all. Thank you.
anything to know?
Please, please. I would like to request Shobhagoda please attend with us and answer some of the questions, please. At the end of the day, we are Bangladesh, please.
Hello.
We are team.
So, my first of all, I really appreciate the. Am I audible?
Yes, yes, you are.
First of all, I'm really, amazed and I'm happy that Bangladesh is doing a great job when it comes to the treatment of children with Clubfoot. My question is that what percentage of the Clubfoot children are getting free treatment? And the other is that what is the poverty percentage in Bangladesh? That in most of the cases, you are telling that it is, the cost is beared by the parents. So, then.
Okay, at present in Bangladesh, our poverty line is below 17%. Below 17%. Then, and another one question.
How many patients are getting
What percentage of the parents?
Percentage of children who are getting free treatment.
Actually, the paperwork is still under process. We will see. We will deliver. Faisal, you want to?
Yeah, I can.
Yeah.
If you want me to respond on your
Absolutely. Please.
can you give me the mic?
Come over here.
Okay. Considering myself a part of their team. So last year we supported 25% of the patient with the miracle feed grant. So out of I'm audible? Yes. Out of 2,200 patients, they have reached out. 1,700 were self-paying and 500 were supported by miracle feed. So rest of and they have a process. Like for example, there is a process to identify the patients. For example, Munim bhai, you allow me to walk them through the process?
Yeah, it's okay.
So when a patient enters into a clinic, they assess their financial status, and they have developed a form. So if someone says they want a free treatment, so they provide that treatment first visit free of cost, and then they hand it over the financial assistance form to them, so that those patients go back to their community, get it attested by the government, like Tehsil office, district office, and the next visit, if they bring that form with attestation, then they start providing the free treatment. If they fail to bring that attestation, then they have to pay for the service. Another thing, there is no hard and fast rule that this patient started free treatment, it will remain on the free treatment. No. And it is also not a hard and fast rule that this patient started a treatment on by paying for the services, he or she has to pay till the end. At some point, if the patient say that they started paying for the services and then they say we cannot pay, then we can. By we means the program cancel. And to answer Asad Bhai's question about how they are reaching around 90-95%. So there's a story behind that. The story is not just about creating groups and all that. There's a huge investment behind that. So for example, when we were supporting actively for all these things, a big chunk of medical feed investment was going to the community mobilization, because they were getting, we were only supporting 500 treatment supplies, but the rest of the things we were supporting for the community mobilization so that they get the patients. So the goal is not to provide treatment by medical feed. The goal is not to provide free treatment. The goal is every children who been affected by Clubfoot gets the treatment. So the model is different. That is the beauty of medical feed. We do not go and say, okay, this is the model, take it or leave it. We go, we sit with the partner, we learn from them, and then if it makes sense, we go with it.
Thank you, Mr.
Done. Okay.
You can add from there.
You can add from here.
My friends raised the concern is about four patients. This target we achieved 36,000 patients. It is not fully actually financed, but fully patient supported treatment. This is a combination of from 2019 they started the treatment and it is achieved in 2024. So in between, huge financial investment was there and free treatment was there. Now their model is independently operate the treatment, running the treatment. It is very from July onward, no? If I am not wrong.
No, 2009.
So this is not
2022. No. The model was introduced to Bangladesh.
This model.
No,
Your model.
When you're not getting, I think
2024 January beginning.
Yeah.
Yes.
So, but achievement, it is cumulative achievement. It is not only for the free treatment achievement. All the things are cumulative here. Thank you.
thank you. So
That is short question. Switch on.
yeah, it's not
Okay.
I'm asking what is the different mechanism in Bangladesh. Sri Lanka. In Sri Lanka, we have mechanisms like from birth, the pediatrician diagnose the condition and refer to orthopedic surgeon for the further treatment. So all of the difference is how come you have the patient. So what's the mechanism?
Thank you, Adil Bhai. You know, our technique and our procedure is totally depends. In Bangladesh, referral system is
Hey, Usman, can you just knock that door and ask someone?
Step back.
I think
पीछे चलो.
when I born birth, that time, no, it's the problem in their miking system, not in here is the mouth system. Thank you. Thank you, NG, Dr. NG. So in Bangladesh, there is a system, is referral system is sometimes there is a when patients go to the hospital, that time doctor referred. Sometimes patients know where the treatment is going on. Some previous patients, and we are publicity materials. Their patients come direct to the physiotherapist. I mean, in our clinic. There is a no government rules strictly is first go to the orthopedic surgeon or first go to the medicine specialist or whatever. Now this time our main ambassador is our previous patient, is the previous patient's parents and their relatives. There is a main source in Bangladesh. Yes, we are applying the caste management. Done only orthopedics, done only tenotomy. After the tenotomy, we follow up. But when patient is ready, we call to the orthopedic surgeon. We have a tenotomy in that day. Are you free? Then at that time they are reply. If they are free, then we are call to the patient. You come to the that time. We are select that time and day. That time we are doing the tenotomy. There is a team, physiotherapist, orthopedic surgeon, and one counselor. Here is our consultative team. Any question? Did you get the answer clearly?
Am I audible enough?
yes.
Yeah. So I just need to take one. I don't have a question for the Bangladeshi team. I just want to share something, if it's okay now.
Sure.
If nobody else has any questions. Okay, so I want to take a lead from what Faisal just said right now, that in when to eat, we just don't tell what to do, we try to learn, and we learn from the partners. We go, we see what you're doing the best, and we build in, we accommodate, we say, okay, this what you're doing is good, and that is the reason why we are here. And I would request everyone to do that, do the learning. This is the reason why we're here. Learning from your laptops and learning from your work. We can do it in our room, we can do it during lunchtime, or we can do it during tea breaks. Or after 5 o'clock or whatever time we finish. We very humbly I'm requesting everyone to switch on their laptop. Until and unless you have a presentation and you're opening your presentation, and trying to put it over there. This is the space. We have traveled, like some people, 22 hours he has traveled to be here, and Pakistan is not far away from Sri Lanka, right? But even then, he has gone all the way and traveled. So everybody has given them the effort to make the presentation. So let us all sit and listen, and please pay attention to each other, right?
Yeah.
Thank you.
Very much.
Much needed, huh? Much needed. So,
Any further question? Just 1 second, not 10 seconds. This is the calendar. This year we published by 11 physiotherapists, and what we physiotherapist and what we give all are from us too. And this calendar we give to our patients, and it will be publicity. And it is for 1 year. Thank you. And another year coming, another poster coming. Thank you. That's it.
you can announce for the lunch.
So after the we are going to the prayer. After the prayer, we are going to the lunch.